Hi, I'm Chris Ellis. I'm the Director of Organizational Advancement at Community Health Center of Cape Cod. We have offices in Mashpee, Falmouth, Bourne, and Centerville, and soon to be Sandwich. Community Health Center of Cape Cod is a not-for-profit health center with offices across primarily the Upper Cape and the Mid-Cape. We provide care for anyone who needs it, and our mission is to improve the health of the community through the provision of comprehensive, high-quality, compassionate health care for all, regardless of ability to pay. So really, the integrated services that we provide are for anyone who needs it. So someone can come in just to receive primary care with us, or someone might come in to receive primary care, behavioral health, substance use disorder treatment, access one of our pharmacies, be able to come in for dental services. And no one is turned away from our health center, regardless of what your insurance is, regardless of what your income is. So we really are here to provide integrated healthcare services to anyone in the community who needs us. So our organization, when the pandemic hit, had to change gears a little bit because of obviously just not being able to see people as much in person as we normally did. So we shifted a lot of our focus to telehealth visits. One of the things that made that really easy for us and a little bit seamless for us in making that transition is that we were already doing telehealth visits prior to the pandemic. So our staff, a lot of our patients were already used to that kind of format. With the conditions as they were, we had to shift a lot more than we typically would. So we went to primarily virtual visits for our patients, which means basically that they would be connected through a remote connection, through an iPad or through a phone, directly to our providers. So we just really wanted to shift as much as we could to our patients to let them know this is how they would need to now be able to see our providers, but to ensure them that they still would get the same quality care that they normally would without having to come into the health center, and really just to be able to do so right from the comfort of their own home. We were really able to make the shift over to offer those telehealth visits to all patients pretty seamlessly. Because we already offered telehealth services to the patients prior to COVID-19 hitting, it really did make for a kind of a quick transition. A lot of patients had already had virtual visits prior to the pandemic, so for them it was easy enough to just continue down that road and continue with some of those virtual visits. For a lot of folks it was new, but we were able to really walk them through what they needed to know. For our patients, we put together an online tutorial and we shared with them through a new text message system that we had, just kind of step-by-step what they needed to know to access that virtual visit. Because we know that for a lot of folks it might be a new way of seeing a provider and something that they might not be comfortable with in advance of doing this. So we want to make it kind of as easy as possible for them. And from a staff perspective, a lot of our staff had already done virtual visits, but we did have to kind of just walk through the steps with a lot of providers to kind of just let them know exactly how it would work. And so this all happened obviously very quickly once everything was coming through and realizing that we needed to kind of adjust on the fly. But it was really amazing to see, the staff coming together just to kind of learn best practices from each other, and same thing with the patients to kind of just adapt quickly. So thankfully, anyone who had medical needs that still needed to be seen at one of our health center locations, they were able to do so, and we were thankfully remained open throughout the pandemic to this day. Something that inspired me over this process through the pandemic is just the response that I've seen from the community and from our patients. As the Director of Advancement at the Health Center, I oversee fundraising and communications, and so one of my roles is just to keep an eye on some of the patient communications we have. So that includes Google reviews, emails that are sent to our website for people just looking for more information, and patient surveys after they've had a visit with us. Throughout the pandemic and to this day, the patient reviews were amazing. They all just had wonderful things to say about the virtual visits, about the communications coming from us, about their experience with the health center. And they really shared some, great stories about being able to kind of just continue receiving the care that they needed at this time. At the health center, we offer primary care. We also offer behavioral health care, dental, optometry. We have pharmacy services. So a lot of people come to us for a wide range of needs. And it was great to see just in reading those surveys and then also in talking with some of the patients, whether it was through email or once we did see some patients back at the health center, just to hear that their experiences were so positive. And it was great to see that the services that we were providing for those patients was well received and that we were meeting our mission to be able to provide care to the people who need it most in our community. The support that we received from the community was outstanding throughout the pandemic. Right when everything hit, we received, even without asking in a number of instances, which is rare in a fundraising perspective, donations from local banks, from local organizations, from individuals who have supported us in the past and from individuals who have not supported us in the past. Because they knew that during this time, we were open throughout. We were always we didn't have the option to kind of close our doors or to take some time off because the people that come to us for care really needed us. So the community really did an amazing job to kind of react to that and to be able to support us throughout. We also were able to host an event in September. We hosted our golf tournament. We have an amazing golf tournament committee made up of all volunteers. Our first committee meeting was right when COVID was hitting. And so we had that discussion of, what do we look to do? Do we decide to postpone? Do we just take a year off? This was the 20th anniversary of the golf tournament this year. And the committee said, nope, let's go. We're still gonna, push on and we'll try our best to see what we can do. And we had the talks about what the break-even point would be and when we would decide to maybe need to cancel. After all was said and done, we had 106 golfers join us. We raised, after expenses were paid, almost $50,000, which is the second most we've ever raised from this tournament in the event's history. And so we had to do a lot of shifting at the event. We weren't able to have our typical award ceremony and big dinner afterwards. But all things considered, we had a great turnout. The people who participated really enjoyed it, and we were able to raise a lot of money that all goes to our mission. So it was really amazing to see again the community rallying behind what we do to be able to come out and support a really good cause. My advice for other organizations to weathering the pandemic is just to really try the best you can to do everything that you can do to meet your missions and to remain positive. I think what was difficult, at least for me personally, especially in the beginning stage of the pandemic, is it was so brand new and it was difficult to try to figure out what would be next and to figure out how to communicate, how to fundraise in a climate like this, how to kind of just go about the normal day because normal is so different now. So I think for anyone just to know that no one has really gone through something like this before. So just trying to again figure out the best ways to achieve what it is you need to achieve, and to learn from each other. We have a great, from a nonprofit perspective, a great community of nonprofits here on the Cape that are all going through very similar things. So use those people to your advantage. Take online courses, talk to your colleagues to figure out what they're doing, and just learn what can be done. And just again, as tough as it might be in a difficult circumstance, remain positive through it and just try your best to get to where you need to go. And keep learning, and things will get easier and things will get better.